welcome to Health Issues. I'm your host, Chris Sylvain, and we really have a great show for you today, and we're excited that, those of you who always watch and spend some time with us. But who we have, and truly a distinguished guest, we actually have this is the newly appointed Dean of Tulane University's medical school, and he's also the Vice President of Tulane University, a great university in the country, around the world, but definitely a major power-packed institution here in New Orleans. We have Dr. L. Lee Hamm. Thank you, Dr. Hamm.
It's a pleasure to be here.
Hey, well,
thank you for inviting me.
Hey, no, we're excited and honored to have you. You know, we talk about it all the time. Tulane has been a great asset for this Health Issues show. To be able to provide so much good information to the people of New Orleans, and so we're thankful. So tell us a little bit about yourself, your background.
Well, I'm a native of Alabama and went to medical school there, undergraduate and medical school there, and then I did much of my training in Texas. Okay. And then I was on the faculty at Washington University in St. Louis for a number of years, and then was recruited to Tulane in 1992 as the chief of nephrology and hypertension, and then I've risen through some of the administrative ranks, and I was, for the last 7 years, up until this month, I was the chair of the Department of Internal Medicine at Tulane, one of the biggest departments at the medical school, and anyway, I'm excited now to take the deanship of the medical school.
Hey, we're excited to have you. 40 years as a physician, am I right?
Just about. Just about. Yeah.
Just about. You've seen medicine change. So first, let's talk, before we talk about medicine changing, let's talk about, you've seen Tulane change. It's been, what, 20 years since you've been with?
Absolutely, right.
20 years. So tell us a little bit about, I like to say pre-Katrina and post-Katrina Tulane.
Right. Well, one of the most dramatic things post-Katrina is our community involvement. So let me just back up a little bit and go through medical schools in general focus on research, education, teaching the students, and clinical care. And Tulane in many respects has always viewed helping take care of the community of New Orleans or the city of New Orleans as one of its missions. But post-Katrina we formally adopted that, to be engaged with the community to help prevent and treat diseases in the community, and that we wanted to be more out in the community, more visible within the community. So that's been one of the biggest things. We've obviously, post-Katrina, we've focused on slightly different things. We've restored, I think, our missions very well. But probably the most dramatic change pre and post-Katrina is the extent and the way that we've tried to engage the community, that we're involved in community clinics, we're involved in a number of outreach programs. So it's been both good for us and hopefully it's being good for the city.
Well, that's one thing. We can see Tulane, from looking at inner city New Orleans and different parts of New Orleans where definitely post-Katrina, we can see Tulane's involvement and through the clinics and other promotional activities. Coming on this show.
Right.
Yeah, it's made a big difference. Well, but the city that we're in, we hadn't seen the needle move much, and that's other thing. We're 49th, 50th, and we fight real hard, I think, to be 51st, but there's only 50 states, so we can't go that far, and probably every indicator of health. Your thoughts on that? Well,
I think one has to be a little bit patient, and you also have to be persistent. What you do as a child and as an adolescent and as a young adult has impact 10 years later, 20 years later. We all know that. And so to move the needle doesn't happen in a flash. It's sort of like, in some ways, like weight loss. You can go on a crash diet, but often the crash diets don't work. They're not sustainable. So it's better to do a sustained effort. And that's what I think we're going about. I do think, we have many more community clinics. I think there's much more thought about that. And this is in the context of a lot of need in New Orleans, but it's not totally different from, there's a lot of need in a lot of places throughout the country. I think New Orleans has maybe more than its fair share of poor health, but we are working on it, I think, maybe in some ways as a model for the country.
Interesting. New Orleans has a high number of gunshot victims.
Right.
And always looking at the Lancet and even the New England Journal of Medicine classifying consistently that type of violence as a medical issue. Your thoughts on that?
Well, it certainly is a life and death issue, so it's hard to say that it doesn't touch on medical issues. And again, it's be much better to prevent than to treat
right.
An act of violence. You know, we have a world-class trauma center right. That both us and LSU are there treating. On the other hand, in the process of improving the city, it in some ways is a health issue. Right. And the other thing, there are, not only does the violent act itself, but communities in which there's a lot of violence leads to stress and all sorts of negative things. So it is part of the health care landscape.
Interesting. So I guess one of the biggest jobs, you know, and tell me I may be wrong, that is guiding the curriculum. Right. Would that be correct? Looking at the curriculum, what would be the priorities that how physicians will be changed? How do you see in guiding the curriculum and training these physicians, I would guess New Orleans making an impact on that curriculum, the violence, the poor health conditions and so forth, of preparing physicians to meet that need, as opposed to, say, a physician in North Dakota or whatever. I think it's a totally different environment.
Well, it is a different environment. I do think, you know, there's certain things that all medical students need to learn. They need to learn anatomy, and they need to learn the biochemistry of the body, the physiology of the body, and different diseases. But they also need to learn how to communicate with patients, both to listen to patients, and we have many physicians that need to work on their listening skills. Also, how to communicate to patients. Not just tell patients things, but tell it in a way and pass along that information in a way that can be understood and can be incorporated. And that's frequently not a one-shot thing. It's education, again, is not something that happens in a single office visit, but something that occurs over time. So that has to be part of the curriculum. I think also part of the curriculum is recognizing that healthcare does exist in the context of the whole environment. So there's a big topic in medical circles these days is what's called the social determinants of health. Correct. And that's things like, well, if you go to the grocery store, do you have the right sort of, you know, are there plenty of vegetables to choose from? Mm-hmm. Or is it mostly foods that are not so good for you? Right. Are there places that you can go for a walk and go for a walk safely? Is it part of the community to get some exercise? This about violence and the stress. And it feeds in with the education system as well. So these social determinants of health is something that has to be part of the learning process that the students go through.
Well, that's interesting because your background is hypertension and nephrology and so forth. So you've been able to see throughout your career firsthand how social decisions affect the kidney and the heart.
Right. So you know your diet and your exercise and your getting your blood pressure under control, they are going to determine your health in the future. So it may not make a big difference how you feel next week, even next month,
right.
But maybe the year later, 10 years later, it has a big impact, whether you smoke or not. Again, if you're 30 years old and you're smoking, well, it may not impact whether you live or die at age 40, but how about to 50? And when you're 30 years old, 50 may seem like a long time away. When you're 49, it doesn't seem so far away.
Next week.
And that's part of the education process, but it also becomes part of the culture.
Next question leads right into it. Because what we saw was, and obviously the point that you were making earlier is that Tulane has always had a powerful mission concerning connecting with the community.
Right.
Tulane doesn't have to connect with the community. It's a choice that it makes. Socially responsible to connect with the community. How strong do you see the role of physicians participating in the community to actually attempt to change the culture, to make it a healthier culture?
Well, I think that, nationwide, but it's particularly true in New Orleans, this about seeing the importance of prevention and healthy lifestyles.
Right.
That's the only way that we're going to have a monumental impact on the health of the country, and it also has huge economic repercussions. Everyone knows that healthcare in this country has an unsustainable financial picture. It can't keep consuming more and more dollars and be more and more expensive. And so we've got to do something about that. And maybe the best way to do that is if we collectively choose healthier lifestyles, healthier communities.
Well, it was that Tom Farley,
right?
Public health dean over in New York, shaking up the world.
Right.
How far should physicians probably push? Because at that point, that's when people say, wait, back off. Don't tell me what to eat. Don't tell me what to drink. It's free will. And years ago, physicians just wrote a prescription. But now it's the idea of coaching individuals. But obviously, the question now is, do we coach whole communities to say, hey, no more big gulp drinks or less sugar, fat, salt, and grease?
I think where it gets controversial is when you absolutely, do you have laws that say that? Or do you educate people? Do you coach people? Does it become part of the culture? And I guess that's in some ways gets into political and social questions that, everyone has an opinion about.
Right.
So I have my own opinion, and it might be one thing, but those are decisions. We collectively we obviously make illegal certain things, but other things aren't illegal. Smoking is not illegal.
Crack cocaine.
We try to. Right. So we do make certain things illegal.
Right.
So there obviously are lines, but I suspect that no parent teaches their children to smoke, encourages them to smoke, because they know it's bad for them, but we don't outlaw it.
Okay.
But there are those that would say, gee, maybe we should.
Yeah.
I mean, I wouldn't necessarily be a proponent of that. I'm not saying that. And I don't even preach at my patients to stop smoking, but I do educate them.
Okay. That's interesting. Now, the next question we hadn't talked about before, but again, another area is dictating not the specifics of who gets into medical school, but what type of student will you guys be looking for? Will you be looking for more of the socially active? We understand that MCAT's changed now, so it's, psych majors and English majors and so forth are getting in the medical school at record rates. Is that true in your own philosophy? Do we need a more well-rounded student applying as opposed to?
We do need, you always need bright students. That's a prerequisite. Right. You need people that are hardworking, but you also need students that are well-rounded so they can relate to their patients. You need students who will be able to communicate with their patients in appropriate ways. You obviously need a high level of compassion, physicians that are going to truly care for their patients. You need a diverse group of students and doctors. So again, so that they can relate to the patients and populations that they're working within.
That's a Supreme Court decision.
Well, and it's it's something that's the right thing to do.
Hey, obviously I agree. Not a problem at all. No, I think it is. I think that diversity is important. Mm-hmm. I think to being able to relate to people, because again, it's no longer writing prescriptions. I mean, that's a small part of it, but coaching and relating to people. The school the culture in which the student goes to determines, that trajectory more or less and everything. But then again, okay, let's swing towards more of this idea of nutrition. You guys have put together a great program over on Broad Street, the Nutrition Teaching Kitchen. A good friend, Dr. Harlan, he's here all the time. Your thoughts on that as far as for the wave of the future? First of its kind also.
Well, I think nutrition has been one of those things that we've not paid enough attention to in medical schools throughout the country. Some medical schools have had nutrition courses and things like that, and you learn what nutrients are good and bad and and the details of that. What this teaching kitchen, though, will do that is completely unique is teach physicians how that relates to what is cooked in the home or what's cooked in the restaurant. Because knowing that you should limit fat, but not knowing what that means in terms when you go to prepare the meal, it may not do you that much good. And if the physician has no idea of it, how are they going to be able to educate their patients about it? And again, if we can make an impact on nutrition, we can make an impact on health.
Your thoughts on that, and also exercise? Because now nutrition, I think somebody did a study, is in a minority of medical schools to even have a course. Most of them, they kind of integrated here and there.
Right.
But I don't know of any medical school that has a course dealing with exercise.
In general, that's true. I mean, there are, in certain scientific programs, there'll be like exercise physiology, and you learn some things about exercise. But this idea that you mentioned about coaching patients or populations to incorporate more exercise into what they do would be a good thing. I'm not sure that anybody adequately knows how to do that. That's one of the types of things, though, that becomes a cultural issue, and we need to understand better, how do we go from knowing that exercise is good for you to being able to have people incorporate it within their lives. And I don't know the answer to that. I think if I knew the answer, the whole world would be beating a path to my door. But and it's a difficult thing to do.
But medicine's big now. I mean, it's changed. I've watched it. I used to say, well, I feel I was a young man, but now I'm hitting to be 55 real soon. So, I mean, you've watched, medical care change so much from the role of the healthcare professional being a team player with the patient, as opposed to before.
Well, I do think that healthcare is it's increasingly recognized that it's a team sport, that it's something that you need lots of people participating in. You need dietitians that we were talking about. You obviously need nurses, which we've long known about, but things like social workers to help people figure out how they get certain things paid for or arrange certain things. But it also, as you just mentioned, having the patient be part of that team. Right. That we don't necessarily tell the patient everything to do and they just do it, but involve them in the process, make certain they understand the process, making certain that they understand what their choices are and what those choices mean.
Now, a good friend, Dr. Lanny Faust, and he's a chemist, and we joke a lot that as medicine and science particularly has gotten more into these flowery fields of nutrition and exercise, things that years ago people would laugh at, but now they've taken center stage. But the context is that what we find is that what stops the physician or the health professional from reaching and understanding those things is really a lack of knowledge about basic science. And you're a basic scientist. Any thoughts on that?
Well, there is a pretty far gap between the basic science and delivering that message and educating the patient and having the patient really understand it. Right. And the patient doesn't need to understand all that, information. Right. But they do need to understand the parts of it that are important to them. Mm-hmm. And patients differ in that regard. Some patients, if you tell them to eat this but not that, that's what they'll do. Right. Others need to know why. Others need to know more details. It's a complicated matter, and that communication process is an important part of that process.
No, but speaking about even the physician's understanding of the basic science, you've studied, you've trained cell biology, mm-hmm. But to be able to explain and illustrate things, it takes a deep understanding of physiology.
Right.
You know, the students that you've had going all the way through, if they understand physiology, they can much better help a patient understand what's going on with their body.
And that is important for the physician to be able to do. They have to understand it to be able to adequately learn it, and part of it is because that understanding will enable them to keep learning too. They have a base to build on.
Yeah, but I guess that's the thing. Do you see the physicians of today being so stretched out where they're losing that appreciation of the cell and basic, I guess, you know, you've studied acid and base, you've done those basic things in basic science, you know, basic chemistry, biochemistry, physiology, whereas if we lose that grasp of it, when it's time to move forward, you know, if we're light on those things, we go nowhere.
Right, and I do think we have to maintain that. We have to add on these other things that we were talking about, like social determinants of health and communication. But the fundamentals the students have to know, and they have to understand how the body works, how the different cells of the body works, how the different organs of the body work, what diseases, how they affect the things. And that, even though the understanding of that will evolve and change with time and we'll know it better, you have to have those basics.
Okay, we got a few more minutes left. If we can kind of shift just a second and look at the context of cost. You mentioned cost earlier, and I heard a passion in saying that something has to change. We won't. Right now, we're around the level of Botswana. You know, I mean, we're in the third world country area, but we spend 10 times more than anybody else.
It is. Healthcare is becoming too expensive, or has become too expensive. You know, companies tell us that their employees, you know, are suffering, that our national competitiveness from an economic perspective, because health care feeds into that. Our taxes are too high. because of the health consequences of that. And we have to ask, are we getting everything that we're paying for? Are we healthier? Well, when you look at it, no, we need to be healthier. And so we have to look at some different ways of doing things. And so prevention is one aspect of that. Coordination of care is another aspect of that. So there are a number of things that we need to do differently. We need to maybe change the way that things are paid for. And you know, we were talking about earlier how, you know, sometimes the federal government and the state government may differ on how they think it should change, but the fact are that both of them think it should change. Right. And so that should be some basis for examining what we do to make certain that we don't just continue to do exactly the same thing.
Keep doing the same thing over and over again and expecting different results. I forgot which word it is, but it's not
right.
Good. We're just about a minute left. Your dream, say, for the next 5 years for Tulane's medical school?
Well, we need to continue to deliver the highest quality education, and that will continue, and Tulane is long focused on that. We need to continue to provide excellent care and teach the students how to deliver excellent care in all the hospitals and all the clinics that we go to. And finally, we're very big on discovering what's next in terms of treating diseases. So the research needs and will expand at Tulane. And we need to continue to be part of the renaissance of New Orleans. So the next 5 years, I think it will be bigger and better.
Awesome. Well, we appreciate you, Dr. Hamm. Hey, thank you so much for watching Health Issues. Hey, let's be a part of the solution and not a part of the problem. Work as hard as you can at everything that you can do, and believe me, you will win. Appreciate you. Watch us on YouTube, Twitter, Chris Sylvain, healthissues2010.org. Thank you.